Hi, I am Dr. Bindu Menon. I am a neurologist from Apollo Specialty Hospitals, Nellore. Today we are going to talk about post-stroke care. Every 40 seconds, someone in the country develops a stroke. There are almost 80 lakh people with stroke every year, and of which around 1/4 of the population is less than 50 years of age who develop stroke. 60% of the people who develop stroke are with disability, and that's why it is very important to recognize the symptoms of stroke, respond and reach the hospital immediately. Even after the stroke has happened and the patient has been discharged, there are several concerns which the patient and several challenges which the patient has which needs to be addressed, and of which one of the most important thing is pain and spasticity. The muscles become tight and the body goes into a sort of posture, and there develops contracture onto the limbs, because of which the exercises are difficult to perform. The patient resists any form of exercise because of the pain. There can be a frozen shoulder because there is no exercise, the patient has gone into a posture. There can also be a shoulder subluxation because the hand is so heavy while the patient is walking, the hand tends to fall down and there is a frequent subluxation. The patient develops swelling, that is edema of the hands and feet, the ones which are paralyzed, which again creates a problem for him to bend the fingers or to bend the hand because of the swelling, that is a fluid within the joints as well as within the intramuscular spaces. The patient also has concerns about cognitive decline. The patient has concerns about irritability and behavioral changes in the person. These most of the time also happen if the patient stops medications, that is the medications which are necessary for stroke prevention, that is the antiplatelet, that is a blood thinner, and a statin, that is a cholesterol lowering drug. If the patient tends to stop this, there are several areas of small dots which the patient keeps developing, and that leads to something known as a multi-infarct state, that is dementia, that is a cognitive decline, that is memory disturbance, walking disturbance and urinary problems, that the patient has urgency while the patient is passing urine. What can one do? Try not to get demotivated. Motivate the patient. Let the patient continue with the exercises. Go to the physiotherapist or learn the exercises from home. You can also use the help of a stroke help app which shows around 17 exercises which one can do with the after taking your opinion from the neurologist or the physiotherapist. Keep the patient where you all are. Try to guide the patient. See that the patient's hands and legs are always moving so that he doesn't develop contractures. Talk to the physiotherapist, get a sling so that you do not have a subluxation of the shoulder. If there is a speech and a language disturbance, try to speak to the patient in short sentences. Try not to burden the patient with multiple sentences and long paragraphs. Keep the patient healthy, active, socialize, move out, take the patient out to areas where he can be mobilized to the best of his ability. See that the patient gets back to work as fast as possible with some disability, even if it is there, and he can or she can cope up with it. Prevent, recognize and respond is the motto, but post-stroke care is as important as any of the three. Thank you.